Hi, everyone, and happy Tuesday. My name is Jillian Parker, and today I'm joined by Jennifer Gutowski, the Associate Director of Infection Prevention at Rochester Regional Health. And, we're a little over a week out from Christmas, and we just want to talk about a couple ways that you can keep yourself and your loved ones safe for the holidays, since they are just around the corner, some of them big, some of them small. Anyone who's tuning in and has a couple questions about how to go about this, please feel free to leave those in the comment section, and we will circle back around at the end and get to some of your questions. But Jen, we'll just get right into it. COVID-19, we've seen the numbers rising a bit. We know that flu is becoming more prevalent. For folks that are planning to gather for the holidays coming up, or even they may have some pre-holiday parties coming up this coming weekend. Is there anything that regarding testing that we should be thinking about? Should people be testing ahead of a holiday gathering with their family? Is there a difference between getting, an at-home test or a PCR test? Is there one that we prefer more than the other for this kind of an instance?
Yeah, these are great questions. And I wish that we weren't talking about this again this year, but it is a year when we're still in very high COVID numbers. So certainly a concern, and it's good to be thinking forward and trying to minimize our risk for our families. So yeah, for testing the county is making a concerted effort to make sure that we have available tests. Many of the easiest tests are going to be the ones you can do at home. Those are antigen tests. They are less sensitive. So if I was symptomatic, that probably would not be my first choice for a test. I would want to go and get the best test available, which would be a PCR test. And most of our Walgreens, CVS's, urgent cares, those are all readily available. Any of our Rochester Regional Health urgent cares, you can go and get a PCR test done. And those will be your most sensitive test. You can feel the best when those are negative that you don't have COVID, but none of our tests are 100% sensitive. So there might be some times where we have some false negatives. So if you're still not feeling well, regardless of that test result, you should not be getting together with family. And that's really the most responsible thing to do, because you just don't want to risk anyone else's health right now. And also, it is a very large inconvenience for anyone to have any illnesses right now. So even if that test is negative, we're starting to see flu coming up, and there's colds, rhinovirus, RSV, those are all out there as well. So could be another one of those viruses, and certainly no one wants any illnesses right now.
Well, and kind of thinking about what you said, I guess there are two ways to think about whether or not you're getting tested. One is you might be symptomatic or have had an exposure, and the other may just be some people just want to get a test just to make sure, even if they don't have any symptoms or they haven't been around anyone that has been exposed to COVID recently. Kind of in those instances, if you're just taking the precautionary measures, but you haven't been exposed, you're not symptomatic, that at-home test, is that kind of good to have at home for those specific instances?
Yeah, thanks for bringing it back to that original question. It is a better resource than not doing any testing. It's some reassurance. It does give you a little bit of peace of mind that you are not positive. If you're positive, the majority of the time the at-home test will be positive. Mm-hmm. If you're negative, it doesn't necessarily mean that you don't have COVID, but it does give you some reassurance. Especially if you're vaccinated, you're already doing everything you can to prevent yourself from getting COVID. It is a nice extra step, and it's readily available. The county is making them available, and you can also buy them at most pharmacies now, and pretty low risk of any pain or side effects because you're self-administering. So in that respect, it's a win-win just to make sure that you have that assurance that you are most likely negative.
My next question is, what is considered a COVID exposure, and is there a difference between someone who's unvaccinated being exposed to COVID and someone who's vaccinated being exposed?
Yeah, and the exposure definitions still do take into account a fully vaccinated person as having 2 doses of Pfizer or Moderna and being greater than 2 weeks from that second dose, or a single dose of the Janssen vaccine and at least 2 weeks from that dose. So if you meet those criteria, you are considered fully vaccinated at this time. There is look towards the future of a booster being part of the consideration, but at this time, if you had your primary series of vaccine, you would be considered fully vaccinated, would not be required to quarantine if you had an exposure. If you are unvaccinated, you're at high risk of developing COVID. This Delta virus is incredibly transmissible. The virus has gotten smarter as it's been able to circulate. So it is very capable of infecting you if you're unvaccinated. So you would need to quarantine at home for 14 days. The county may make allowances if you test negative at a certain point, but you could be potentially out of work or home from work and school for the full 14 days if you're unvaccinated. And when we talk about what an exposure truly means, that's when CDC defines it, it is 15 minutes within 6 feet of another person. And CDC used to have an allowance for if you had a mask on. They actually took that away for the community because they didn't know what type of masks people are wearing. So sometimes people have just a neck gaiter or a non-well-fitting face mask. So they want to take out some of that guessing. So if you're within 15 feet of someone within 6 feet of someone for more than 15 minutes, you would be considered exposed.
So having said that, should people avoid gatherings with the holidays around the corner if they've had that exposure?
Yeah, and I think this is the year where we still have to protect our family and our friends, and I would hate to be the person zero at a party where I spread COVID to my loved ones. So it's still, I would think if you had any exposure, any symptoms, this would be the year to apologize to your loved ones that you wouldn't be able to see them at the holiday. If you are just exposed, still feeling well, I mean, you might be able to meet up outside, stay 6 feet apart, and give everyone your best, but it's not the time to go congregate indoors, because those indoor settings are going to be the highest risk for transmission, and COVID is easily shared between people indoors. So definitely, if you're on quarantine or exposed, even if you're vaccinated and exposed, I would use caution and not go to those gatherings indoors.
And, with that COVID-19 fatigue that so many people are having, there's going to be holiday gatherings of all different shapes and sizes this year, in terms of big and large, a gathering of fully vaccinated people, a gathering of mixed vaccinated, unvaccinated, and then there are probably some gatherings where there will be fully unvaccinated people there as well. So do we have different guidelines that we're recommending, based on whether or not you are in a fully vaccinated holiday gathering versus a mixed vaccinated and unvaccinated gathering?
Yeah, and I think going into the holidays, this is the time to ask yourself where you fall on the spectrum of COVID concern. You might be someone with a compromising condition, so that is going to change your risk perception. It might be that you have young children who are unable to be vaccinated. When you are congregating indoors, even if you're all fully vaccinated, if you're with people that aren't in your household, you're taking one set of risk. You increase that risk with each element. So if there's unvaccinated people indoors, that's an extra element of risk, because someone who's unvaccinated, it's just a matter of time before they get COVID. We know Delta virus is incredibly easily spread. So it's at this point, the decision is either get the vaccine or get COVID. So if you know that someone is unvaccinated, they could be a risk to you for having COVID, and they may be asymptomatic or pre-symptomatic. So anytime you're congregating indoors, it's already a bit of a risk. But then once you add unvaccinated people into the mix, you're increasing your risk. If you're unvaccinated and indoors, you should still be wearing a mask per CDC guidance. But realistically, we know we're with family and friends, so it's hard to expect that of people who 2 years ago we would have been hugging and sharing drinks with, and now it's a much different scenario. So assessing the risk that you have personally will help inform how comfortable you are with going into a situation where you have unvaccinated people who may have COVID. And again, even if someone is vaccinated, if you're congregating indoors with multiple people, it could still be a little bit of a risk. So we can do things like opening windows, eating separately, different rooms, different tables. But if it's somebody who's not in your household, even if you're vaccinated and they're vaccinated, there is a little bit of a risk there.
So we're math is not my strong suit. 10 days, 11 days from Christmas. If we think about, given what you just said of not putting yourself in a potentially situation of risk, are there things that people can be doing now at the length of time that we're out from the holiday to mitigate any risk so that they can feel a little more comfortable being with their family members when we get to the holiday weekend?
Yeah, and this might not be the time to get together with all of your coworkers if your priority is to see your family on Christmas, because doing some of those riskier Christmas parties now and that may lead to you find out you're exposed next week when this person tests positive, and then your Christmas may be ruined because you can't go see your family. So leading up to Christmas, I would be aware of what situations you're putting yourself into. Is there a way that you can go to the Rock Holiday Village and be outside, or some of those activities that may not be indoors with your coworkers or friends as you lead up to Christmas? And as always, I would recommend a vaccination. If you're not vaccinated, this is the time to initiate vaccination because, like I mentioned previously, we're basically given the choice at this point, given how easily COVID is spread, about getting a vaccine or getting COVID. And I know when you just mentioned the math, you won't be fully vaccinated by Christmas if you're unvaccinated now, but it's still a step in the right direction. If you're fully vaccinated now, you could get a booster. I know some of those appointments are hard to come by, but if you get a booster right now, CDC was studying the effects of a booster 7 days after you had that booster. So I would think it would be pretty effective by the time Christmas rolls around if you were able to get that booster in the next few days. And you would also feel well by the time that Christmas came. I know when I had my booster, it felt very similar to my second shot. I wasn't feeling great for a few hours, but it quickly dissipated. So we're really just looking at maybe a day of feeling a little crummy for the win of not having COVID.
And for anyone who had, their first and second shots already, if you had some symptoms, the second vaccine, I'm thinking probably pretty similar to that person. I know everyone's experience is different, but that person's specific experience.
Right.
Food sharing, communal dishes. It's different if everyone's got their own, sit down plate at the table. Things like chips and things where people are putting their hands into the same things. Recommendations as far as those type of food items and what people can be doing to limit any hand touching and sharing of the foods like that.
Yeah, it's been an interesting 2 years now where people have gotten very creative, and it's been a lot of fun. Even for Halloween, we had neighbors using a shoot method of handing out candy. So this might be the year to try out your creativity and try to plate things individually for people. That would be one of the safest ways. The risk really isn't foodborne transmission. It's not going to be your potluck where everyone gets diarrheal illness from a shared food. It's really the risk of taking your mask off and eating closely with others. So what you want to do potentially is have your food away from the congregation area. So if everyone's gathered around the kitchen island, that might not be where you want to have all the food, although people tend to gather around food. But having the food in a place where it's not going to be beneath the conversation. You could mitigate some risk by ensuring there's spoons and dips and individual plates so they can put their dip on their plate, and we're not sharing an individual container amongst people. It's really just thinking through who's going to touch this and is it going to go right into their mouth. So just thinking that through.
One other thing that I wanted to bring up before we close the conversation is advice for people on how they can talk to their loved ones. You and I just chatted about this last week. Just you're going to have people with all different opinions regarding the vaccine at your holiday gathering. Kind of just how to talk with them about that during the holiday, maybe to say, let's leave it off the table for the holiday, or how to go about having that conversation without it, leading to an argument.
Yeah, and it's a little bit of a scary time because I know the vaccine's been a little politicized, and politics are always something you want to leave off the table at the holidays. But we really, I think, need to be honest with ourselves about how we feel COVID impacts our life and what risk we feel is COVID to our personal health. And so if it is a strong concern and we really, for moral obligations, don't want to spread COVID, or for personal reasons don't want to risk our own health, I think we need to be honest with our loved ones. And I wish I had an easy solution of say this and everyone will be fine with it, because it's difficult to know how people will react to your stance on anything in this world. But what I have found is that people are pretty understanding still. If you phrase it as you're protecting your own health and well-being, or you're still trying to be responsible, you can kind of keep it light, and not feel that you have to lecture someone on their vaccine stance, although you can certainly say, I believe vaccines are the safest way to get us out of this. But what I would do is just really be honest with how you feel. You don't want to put yourself at an increased risk of COVID. You're still playing it safe. Your young child doesn't have a vaccine yet, so you just don't feel comfortable. You don't have to disclose, but you could say, I have an immunocompromising condition. I just am really fearful of going to the hospital right now. I mean, all of these are honest ways to tell someone that COVID's still something that you're concerned about. And if they respect you and they respect that, hopefully they would understand. I know I've struggled with these conversations and getting the nerve up to have them, but when I did, I was really pleased that everyone has been understanding.
Anything else that you want to add before I let you go?
I would just say at this point, I hope that we all have that moral and personal reflection of keeping each other safe at this time of year. I know we're really seeing this pandemic continue like we never expected, and our hospitals are feeling a great surge right now, and it's difficult for all of us healthcare workers. So I appreciate everyone who's doing their part to get vaccinated and stay safe. Keep yourselves out of the hospital. We just all need to band together to end this pandemic, because it's certainly still taking lives, and that does really affect us all, and it's tragic. So I would say happy holidays. Enjoy yourself the best you can. I still want to have that holiday cheer, but definitely stay safe, because COVID is unfortunately still with us.
Jennifer, thank you so much for taking time out of your day to talk about this with us. And you have a happy holiday and be safe as well.
Thank you.